Welcome to this first in a series of Global Matters That Matter. The principal subjects of the series include water, food and food sustainability, cancer, media literacy, and human trafficking. It's not a coincidence that the first of this series of Global Matters That Matter is water. Without water, as we all know, none of us, rich or poor, Democrat, Liberal, or Conservative, can survive. Our speakers on this subject today are Dr. Rita Colwell and Kurt Sonderland, representing our co-producers, the Safe Water Network, that, as many as you know, was co-founded by the actor Paul Newman.
Safe water is a universal need. Every one of us requires water simply to stay alive. The problem is that water is not necessarily safe in many parts of the world for many millions of people, perhaps billions. The diseases that are transmitted number probably 24 or more just from water that's not safe. In fact, of the 26 or 25 or 26 diseases transmitted by water, there are vaccines for only 2. It's a simple bacterial disease that the bacterium can be cultured in the laboratory, but it's devastating to the individual who ingests the organism, which then attaches to the intestine, causes severe diarrhea and vomiting, and hence death from dehydration. Cholera is a universal global disease. It's an acute watery disease. We refer to the epidemics of cholera as pandemics, and we have begun enumerating these massive epidemics going back to about 1960. And we are what's now termed the 7th pandemic. Unfortunately ascribed to the Bengal Delta, but until 110 or 20 years ago, New York City, Washington, D.C., the Gulf of Mexico, even as far as the St. Lawrence River, epidemics occurred every summer. We now know that the bacterium is really naturally occurring in the environment because it cannot be eradicated, but it certainly can be controlled. We're able to isolate DNA, sequence it, and with the capability of being able to use the sequences to match up against a very elegant, elaborate library and to identify all of the bacteria, viruses, fungus, and parasites present in a given sample. And this allows us then also to go further. What can we do in the case of remote villages? And we thought that, we could probably filter out very simply the cholera bacteria in these parts of the world by simple filtration. So we tested a variety of materials, and we found that sari cloth in Bangladesh, available to every family, gave a really effective filter. And as you can see from the water sample in the beaker on the left is turbid, lots of particulate matter, and that is the water the villagers would be drinking unless they filter. And you can see on the right-hand side, water is clear. I mean, it's not totally free of bacteria, but the numbers have been reduced so that it is no longer dangerous. We were able, by instituting this simple filtration technique, just in educating the women in the villages, when they collected the water in the morning for their families, to filter it through this sari cloth filter, and then when filtered, just rinse the sari cloth and leave it in the sunlight to dry, which the sunlight acts as a disinfectant. And so we were able to reduce cholera by 50% by this simple technique. Water is the most important resource, and it is a diminishing resource that we face in the next decade or 2 or 3, and that wars will be fought, wars have already been fought over access to safe water, that I think we really need to have strong discussion about how we protect this resource, how we provide safe water, and prevent many diseases that are transmitted by water.
Just to reinforce the point that water is so essential and critical, I think most people get it, but honestly, there's too many people who take it for granted. And one of the things that we're looking to do is raise awareness and visibility and ensure a greater sense of urgency around this challenge and issue so that the resources can be deployed to make a difference against this global challenge. Many of this is grave consequence. About 2 billion people don't have the benefit of safe, affordable, reliable water. There's a recent study by the World Bank came out that if spending levels don't change, if it's just held constant, by 2030, the number is going to go to 4 billion people. So that's just business as usual. So imagine the grave consequences on these economies and livelihoods of these populations. And that requires a much greater sense of urgency around solving this challenge. There's death, there's lost school days, enormous economic productivity that's lost. So why is there such a struggle? There's billions of dollars spent, yet poor water quality, and this is grossly understated. This is sort of the public data. 30% rural water systems are non-functional. Our own experience indicates that it's much closer to 70, 80, 90%. We've got a few guiding tenets. One, safe water, sufficient supply, accessible, affordable, and financially viable. And acceptable to the community and all the participants throughout. So how do we bring together the resources to make that a success? We're talking about basically small, medium-sized villages, 3,000, 5,000, 6,000 people. There's source water available, treatment plant is constructed, affordable water, 3 to 5 cents per jerry can, that's 20 liters, that's usually enough supply for a household. Water pays for the operations, technical services, maintenance, capital recovery, set aside account for future. Training the local operator, run it like a business, because you've got to respect the whole supply chain. If there aren't incentives in it, it falls down, it breaks, and there's too many examples of the lack of incentives to maintain and sustain these systems. And then, of course, education and outreach. So people break practices of going to the dirty water that might be more convenient and certainly cheaper, and are willing to pay a very modest amount for the safe water. And then we extend it. One of the beautiful things about this approach is that you can move communities up the water services ladder. So you might start with people bringing a jerry can to collect the water, and over time you extend it to have more distribution points and household connections, which ultimately, of course, is where we are looking for all communities to get to. So the results, we're now operating in about 350 systems across Ghana and India, approaching 1.5 million people in the service area. We're beyond piloting phase, but to really provide a credible, at-scale demonstration against key measures of performance that we can take to governments, to big funders, United Nations, World Bank, and really showcase how to get this right, how to scale it up in a country so that the billions of dollars that are being spent can be spent much more cost effectively against these systems. Now our job is to mobilize the political will, the resources to take this, and the partnerships and collaboration to take this to the next level.
If you could make just one statement to the global media to bring them into being part of the solution, what would that be?
When we provide good health and safety to others, we provide good health and safety to ourselves.
Lives, economies are at risk, and it's solvable and senseless that we haven't deployed the resources, capability, and talent to right that situation.
Suggestion, building a synergy with the media can be an effective tool in breaking down government and particularly bureaucratic bottlenecks and the resistance to turf protection.
All I would say is, the reason I'm here is because I agree with you.
And I wish you all a very good night from the FPA USA. Thank you.